Hello everyone. I'm Prima Mendoza, reporter number one, and today I will be discussing the fundamental principles of netiquette in nursing communication. Specifically, I will focus on three key principles: respect, clarity, and professionalism, and how these apply to our communication with our colleagues, patients, and other healthcare professionals in a digital environment. What is netiquette? Let's begin with a simple definition. Netiquette is the code of proper behavior and courtesy in digital communication. Just as we practice bedside manners when interacting face to face with patients, netiquette in our digital bedside manner. In nursing communication, is critical and mistyped instruction in email, a poorly phrased message in a group chat, or an unprofessional comment during a teleconsultation could all lead to misunderstandings, reduce trust, or even compromise patient safety. This is why Netiquette matters. It ensures that our digital interaction remain respectful, clear, and professional no matter what the platform. What is Netiquette? Definition of Netiquette is a combination of internet plus etiquette. It means respectful and professional digital behavior, how we communicate online, especially in emails, messages, or professional platforms. Also, in healthcare, this isn't just about being polite, it's about ensuring safe, clear, and trustworthy communication. Now let's dive deeper in the three fundamental principles. First is respect. Respect online means using polite language, being considerate of the receiver's time, and avoiding offensive remarks. For example, when sending a group email to colleagues, respect includes using proper salutations like good day team instead of informal or careless greetings. It also means not using all caps, which can come across as shouting. Second is clarity. Digital communication lacks tone and facial expression, so it's easy for messages to be misunderstood. That's why clarity is vital. For instance, instead of writing give meds later in a text message, a clear and safe communication would be administer 500 milligrams of paracetamol PO at 2 o'clock p.m. as ordered by Dr. Santos. Clarify prevents medical errors and ensures instructions and correctly understood. Third is the professionalism. Professionalism online means maintaining the same ethical and professional standards as we do in the hospital. This includes proper grammar and a respectful tone, and not using slang when communicating with patients or doctors. For example, in telemedicine consultations, professionalism means addressing patients formally using evidence based explanations and avoiding casual or overly personal comments. This slide highlights respect as a core principle of netiquette in nursing communication. It breaks down into four key points. The first one is polite greetings and tone. Begin digital interactions with emails, messages, or telemedicine calls with polite openings like "Good morning, ma'am and sir," "Good morning, doc," and maintaining a tone that is warm, courteous, and not rush or harsh. Second is the acknowledge colleagues and patients. Recognize the person that you are communicating with by addressing them by name or role. And for patients, this shows empathy and makes them feel valued. And for colleagues, it fosters teamwork and mutual respect. Third is be culturally sensitive. Nurses often interact with people from different culture backgrounds. Cultural sensitivity in wording or symbols, expressions avoid misunderstandings and promotes inclusivity. Fourth is avoid dismissive or abrupt language. Short or harsh response can't be misinterpreted as disrespectful. Instead, frame responses with professionalism. Let me direct you to the right person, sir, or I'll handle this as soon as possible, ma'am and sir. This slide emphasizes how clear communication prevents misunderstanding and ensures safe, effective nursing practice. The points are: first is use simple, precise language. Avoid overly complex words. Patients are even colleagues and interpret things differently if the wording is complicated. Example, instead of you're presenting with cephalgia, say you have headache. Second is avoid jargon unless necessary. Medical jargon can confuse patients. Use it only with healthcare professionals when it's needed for accuracy. And for patients, always explain in terms in plain language. Third is structured, concise emails or messages. Organize digital communication logically. Use short paragraphs, bullet points, or clear subject lines. Example, instead of writing a long, unbroken email, divide information into sections like background, action needed, and follow up. And for the last one is confirm patient understanding. Never assume patients fully grasp digital instructions. Use techniques like teach back or where you ask, can you explain in your own words how you'll handle this medication? Or in telemedicine or text communication, ask patients to repeat or confirm key details. This slide reminds us that digital communication reflects the nurse's role as a trusted healthcare provider. First is correct grammar and tone. Poor grammar or careless wording can come across as unprofessional. A professional tone is respectful, courteous, and avoids slang. Example, instead of hey doc, labs are here. Right? Good afternoon, Dr. Santos. The lab results are attached for your review. Second is confidentiality always. Patient information must be protected at all times. Avoid sharing details through unsecured channels. Always follow HIPAA or institutional guidelines. Third is timely responses show reliability. Delayed response can affect patient safety and disrupt teamwork. Replying within a reasonable time frame demonstrates responsibility and reliability. Fourth is follow workplace communication policies. Every healthcare institution has rules for digital communication. Examples are encryption requirements, approved platforms, or specific ways to document patient interactions. Following these policies ensures consistency and legal protection. This slide shows how small changes in tone, wording, and structure reflect the principles of respect, clarity, and professionalism. The first one is incorrect example. So stated here needs lab ASAP, send results now. The tone is abrupt, demanding, and possibly disrespectful. And for the clarity, while urgent, it lacks proper context, which patient or what labs. Professionalism, no greeting, no courtesy, and no overly commanding. For the correct example, good afternoon, Dr. Yes, could you kindly provide the latest lab result for Mr. Mendoza at your earliest convenience? Thank you. Respect starts with polite greeting and uses the recipient's title or name, which is Dr. Yes. Clarity identifies exactly what is needed. Lab results for Mr. Mendoza. Professionalism maintains polite tone, includes courtesy phrases, kindly, thank you, and avoids unnecessary urgency unless absolutely required. So this slide highlights three key principles. First is maintain eye contact and smile. Even through a screen, nonverbal cues matter. Looking into the camera stimulates eye contact and shows attentiveness. Third is warm smile creates reassurance and help patients feel respected and cared for. Second is use plain, clear language. Digital consultations can feel rushed or technical, so clarity is essential. Avoid jargon or abbreviations that patients may not understand. Example, instead of take BID, say take this medicine twice a day. Third is check understanding. Never assume patients fully grasp online instructions. Use simply questions like, do you feel comfortable with these instructions? Or can you explain back how you'll take this medicine? This ensures clarity, prevents mistakes, and empowers patients. This slide shows how digital communication within a healthcare team should balance efficiency with respect. So the first one is be brief but respectful. Healthcare settings are fast paced, so messages should be short and to the point. But brevity should never come across as rude. Example, instead of send a report, write please send the report when ready. Second is avoid all caps because it feels like shouting. Writing in all capital letters online is often interpreted as yelling. For instance, check this now can sound hostile. Use normal capitalization and polite rephrasing to keep tone professional. Add please and thank you. Simple courtesies transform tone from demanding to collaborative. Example, instead of update chart, write could you please update the chart? Thank you.
Good day, everyone. My name is Shania Pantanosas, and today I will be discussing ethical and legal considerations in social media for nurses. With the growing use of digital platforms, this topic has become very important to our practice as future nurses. Social media is a powerful tool for nurses. We use it for education, communication, and even advocacies. However, while it brings many benefits, it also creates serious challenges. The main challenge is how to protect patient privacy while maintaining professionalism online. So, as nurses, what we post can directly affect our patients, our profession, and even our legal standing. So, now let's talk about the legal responsibilities that guide us. First, the Philippine Data Privacy Act of 2012, or RA 10173, protects all personal and health-related information. So if a nurse discloses information without consent, even by posting online, it can lead to penalties. Second, the Nursing Act of 2002, or RA 9173, emphasizes our duty to keep patient information confidential and to always practice accountability. So internationally, the Health Insurance Portability and Accountability Act, or HIPAA, in the United States protects medical records and patient health information. So it requires secure handling of data and imposes penalties for unauthorized sharing. So even though it's US based, it sets global standards for how health information should be handled. And finally, the ICN Code of Ethics serves as a global guide for nurses. It emphasizes respect for human rights, dignity, and confidentiality, reminding us that professionalism is not only inside hospital, but also extends to our online presence. So next is risk of violations. So if these legal duties are not followed, there are serious consequences. This includes a breach of confidentiality, which can harm patients, legal penalties that may be imposed on the nurse, a loss of public trust in the profession, and even disciplinary actions from nursing organizations or school. Ethical dilemmas. Social media often put nurses in difficult situations. Sometimes we want to share experiences from work or post something that reflects our daily challenges. But even without names, simple details or photos can still indirectly identify patients. This creates a conflict between our freedom of expression and our professional duty to protect patient confidentiality. So as nurses, we must always choose to prioritize patient rights. So rule of Netiquette. To help manage these challenges, netiquette or proper online behavior plays an important role. By practicing respect, caution, and professionalism online, nurses can avoid misuse of digital platforms. So, netiquette is not just about being polite, it's about protecting our credibility, our patients, and our profession. Preventing violations. So, how can nurses avoid these violations? First, never post identifiable patient information or photos online. Second, avoid discussing workplace issues publicly. Third, always follow institutional or hospital policies regarding social media use. And finally, uphold professional ethics both online and offline because being a nurse is not only a role, it's a responsibility we carry everywhere. So, nurses can and should use social media responsibly. These platforms can be powerful for health education, advocacy, and professional growth, but only if used wisely. By following national laws like Data Privacy Act and the Nursing Act, international guidelines like HIPAA and ICN Codes of Ethics, and by practicing good etiquette, we can protect confidentiality, maintain professionalism, and strengthen the trust placed in our profession. Thank you, and that ends my report.
So, hi everyone, I'm Rick Oniel A. Campos, and I will be reporting the netiquette rules of different communication types and professional conduct. So, netiquette rules for different communication types and professional conduct. Netiquette simply means network etiquettes are the proper and respectful way of communicating online. As a nurses, the way we communicate, whether through email, text messaging, or online forums, not only reflects our professionalism but can also directly impact patient safety and our careers. So, first is email and text messaging etiquette. These two are the most common tools used in professional communication, but if not used properly, they can easily cause misunderstanding. So, first is timeliness. Always response within a reasonable time. In professional settings, delay can cause miscommunication or even compromise patient care. So, next is the tone. Messages should be polite, professional, and free for sarcasm or slang. Remember, the tone can easily be misunderstood in written form. Next is confidentiality. Never share sensitive patient information through unsure email or text. Always think before hitting send. Next is the online forums and professional groups. With the rise of social media and online communities, many healthcare professionals share opinion, advice, and experience online. However, this also requires discipline and boundaries. So, first is professional boundaries. When participating in online discussions, especially in professional groups, comments should remain respectful and aligned with the nursing standard. Next is the nuance of online interaction. Avoid arguments, offensive remarks, or oversharing personal opinions that could damage your credibility. Next is staying professional. Even if you're in formal forums, you still present yourself as a nurse, maintaining a professional image, protect both you and your workplace. Third is the rule of etiquette and nursing. First is maintaining reputation. Proper online behavior build trust and preserve your professional reputation. A single unprofessional post can ruin your years of hard work. Next is the patient safety. Poor etiquette like posting patient-related content online can directly harm patient and breaks confidentiality laws. Fourth is the consequences of unprofessional conduct online. First is career impact. Employers often review social media and online activity. Inappropriate posts or disrespectful comments can cost you job opportunities. Next is legal and ethical risk. Sharing confidential information may result in disciplinary action, suspension, or even loss of license. Lastly is the personal versus professional life. Remember, what you post outside of work can still affect your career. Nurses are always held to a standard of professionalism. Lastly, the outcome and importance to summarize adhering the netiquette rules is not just about being polite, it's about ensuring. First is professionalism in all types of communication. Next is the protection of patient safety and confidentiality. Next is safeguarding your career and professional reputation. So, the conclusion and summary, the fundamental practice of netiquette in nursing communication remind us that respect, clarity, and professionalism should always guide the way we interact. Whether online or offline, with the increasing use of technology, nurses must also be aware of the ethical and legal responsibilities on social media where even a single careless post can compromise patient confidentiality, damage professional reputation, or lead to legal consequences. Finally, by following the netiquette rules for different communication types such as email, text messaging, and online forum, we can ensure timely, respectful, and safe exchanging that protects both patient and healthcare professional. So that's all. Thank you.